So good morning, good afternoon, or good evening. We're about to get started here, so thank you very much for joining us today. On behalf of the co-host of this event, the Norwegian Ministry of Foreign Affairs, the permanent mission of Jamaica to the UN, the UN Interagency Task Force on NCDs and the NCD Alliance, a very warm welcome to today's event entitled Building Forward Better, a new approach to mobilizing investment for non-communicable diseases, taking place on the sidelines of the first virtual UN General Assembly. My name is Katie Dane. I'm the CEO of the NCD Alliance, and I'm delighted to be kicking us off for this important event. Before we dive into the topic and focus, just a few very brief kind of housekeeping from my side. Firstly, just a reminder to everyone to engage in the conversation and to be asking questions throughout the event. You can do that by posing your questions to the panel in the Q&A box on Zoom, and obviously sharing your views on social media, tagging at NCD Alliance and using the hashtag Act on NCDs. Secondly, this event is being recorded. The video will be made available later this week on our Facebook page, so you can listen back at your leisure. And finally, and most importantly, we hope everyone finds this event inspiring and challenging for all of us to be playing our role in mobilizing more action on NCD investment, the topic of today. So in a few moments, I'll be handing over to our moderator, Dr. Rachel Nugent. But first, just to provide some brief opening remarks to help set the scene and kickstart the conversation. Today and during this week of the UNGA, we're all very aware that we can't be talking about accelerating action, investment and financing on non-communicable diseases without talking about COVID-19 and the impact it's having on societies, on health, on inequalities and on the economy around the world. And for this reason, increasingly COVID-19 is being referred to as a syndemic, where two categories of diseases are interacting, namely COVID and an array of non-communicable diseases, and that these conditions are very much clustering within social groups according to patterns of inequality deeply embedded within our societies. And so these three elements of this endemic, COVID, NCDs and inequalities, are very much the major health threats of our time and work in tandem, exacerbating one another and their global impacts. And actually, by taking a syndemic approach to COVID, it becomes clear that the response now, as well as building back better and differently by our political leaders and governments, must include valuing, prioritizing, and investing in health, NCDs, and addressing societal inequalities and disparities. It's becoming very, very clear that our society simply won't be truly COVID secure or prepared for the next pandemic unless we really get to grips with NCDs, their causes and their upstream determinants. On the flip side of that, we're very aware as a community that the level of investment to date on NCDs, an issue that affects over 1.7 billion people or 22% of our global population, has been starkly inadequate and shameful in some contexts. The recent Lancet NCDI Poverty Commission report showed that just 1% of development assistance for health has gone to NCDIs since 2001, and that between 2011 and 2016, which we all know has been a period when NCDs were included in the Sustainable Development Goals and recognized as a development priority, of that 1% global DAH for NCDs, just 1/10 went to the poorest countries. So that's 1/10 of 1% of DAH for NCDs and injuries going to the poorest countries. And it's becoming increasingly clear that the economic context facing governments now and in the years to come is just only going to get harder due to COVID, with governments really grappling with prioritizing health issues within tight budgets and already overstretched and overburdened health systems. So as a global health community, we're not walking the talk, we're not reaching the last mile, and we're not starting with those that are left behind, and we need to change that. On a more perhaps optimistic level, we as a community, I think, have made some small but perhaps really important strides in responding to the financing gap that will be the topic of discussion today. For example, we've seen a shift from describing NCDs as a cost to an investment, and that's reflected by the growing number of national investment cases that governments have been developing, as well as obviously the global investment case developed by WHO a few years back. There's also a consensus on the need for blended approaches to financing, which are country-owned and country-led, including a mixture of domestic resources, catalytic ODA, innovative financing, and private sector support. That for least developed countries and low-income countries, it is unfeasible and in some ways unethical to think that domestic resources alone will be sufficient to finance NCDs, and this is where catalytic ODA plays a critical role. And for this reason, seeing the first OECD country, Norway, launch a dedicated NCD strategy as part of their international cooperation with low middle income countries last year is a very promising step forward, but we obviously need to see others to be following in their footsteps. And finally, there's now a momentum around the first dedicated NCD financing mechanism, the multi-partner trust fund on NCDs, which will fill a sizable gap by responding to demand from low and middle income countries for technical cooperation on NCDs. So within that context and against that backdrop of the UN General Assembly, and specifically some deliberations that have been taking place between heads of government and heads of state on financing for development, we want to instigate today a new level of discussion on NCD investment and financing, exploring areas of progress and solutions, and really trying to dig into some difficult questions. How do we mobilize investment on NCDs during and after a global pandemic and an economic recession? And what do we need to be doing differently now in this new COVID and post-COVID world? And so with that, I'm very pleased to hand over to our moderator for today, who needs no introduction to our community, Dr. Rachel Nugent. Rachel is Vice President of RTI International Centre for Global NCDs and an affiliate associate professor at the University of Washington Department of Global Health, and comes to this with 30 years of experience in global health and development as an economist, as a researcher, practitioner, a policy advisor to government, and is well known to our community as a real thought leader on NCD investment and financing. So who better to lead our discussions today? So let me pass over to Rachel. Over to you.
Okay, hello. I think I can be heard. I don't think I can be seen yet, but oh, I guess I can control that. Here we go. Great. Thank you so much, Katie. And I want to add my thanks to the sponsors of this event. I'm very excited to be here discussing this topic. Thank you to the Permanent Mission of Jamaica, to the United Nations, to the Norwegian Ministry of Foreign Affairs, the UN Interagency Task Force on NCDs, and of course the NCD Alliance. And thank you, NCD Alliance, for the invitation to moderate this event. We have really an excellent lineup. I am going to give a little bit of guidance to how we're going to proceed today, and then we're going to jump right into the first panel. The guidance is that we have a wonderful panel, a number of speakers who will very briefly give us some catalytic thoughts about several themes for today. And we'll have discussion amongst all of the speakers, and we invite your own questions and comments in the Q&A box so that we can have discussion with you along with those discussions of the speakers. Our themes, we have 3 themes, and we're going to have then divide the webinar into these 3 sections with some catalytic remarks for each of those 3 sessions, and we'll try to sort of stay on those themes as we go through the webinar. The first theme will be on understanding NCDs as a threat to health security. I think this is top of mind for all of us. We understand very well that in light of the emergence of COVID-19 and the very obvious additional risk that it poses to people living with NCDs and people with exposed to NCD risk factors, it is much more of a threat than simply another emerging infectious disease, which is in itself a hard enough thing to deal with. But we're dealing with a combined threat here, as Katie said, a syndemic, as some people call it. That will be our first theme, and we'll have a couple of speakers give us some remarks. We'll then move to the second theme, which is to talk about integration, trying to move past the siloing, the disease-centric approach to global health, but integration of care for people living with NCDs who may also have other conditions, and vice versa. How do we do that? How does financing play into that topic? And we will have a few speakers, again, very briefly giving us some remarks to open up the discussion. And then finally, our third theme will be on financing, specifically on innovative financing and mobilizing investors. And I think many of us on the call have spent a number of years thinking about that, trying to answer the questions that potential investors and funders have about NCDs as they have come on to the global health stage in the last decade and a half. There have been a lot of questions. What can be done that is effective and cost effective? We've answered that. What can countries actually implement, especially poorer countries? We've answered that and demonstrated that it can be done. Why should investors do that? Fund NCDs and NCD care, not instead of, but in addition to providing necessary funding for other areas of global health. We have answered that as well. And the Lancet NCD and Injury Commission that came out just 2 weeks ago, that you'll hear more about later on, has very strongly and directly shown the link between NCDs and poverty, which I think is important to us all here. So that link has been demonstrated in many ways through that commission report and through other investigations. And that should mobilize those funders who say that they are concerned about the poor worldwide. And with COVID-19, circling back to our main theme here, with COVID-19, we know that number of people has grown, and they include many, many people with underlying NCDs who already are extremely neglected in the areas of global health and country service delivery. So with that, I'm going to again invite you to pay attention to the Q&A box, and I am going to introduce all of the speakers very briefly here. So we will take care of that. The bios will be available to you. Let me see if they're available to me here. There we go. I'll introduce all the speakers, and then we will proceed into the first theme. So we will start with Dr. Colin Tokwitonga, who is the former Director General of the Secretariat of the Pacific Community, and who has a lot of experience in working with countries on NCDs. He is now Associate Dean in the Pacific University of Auckland. And along with Dr. Colin, so excuse me for having lots of papers here. In the first opening remarks, we'll hear from Francesca Colombo, who is head of the health division of the OECD. We'll then move on to the second theme, and we'll hear opening remarks from Professor Dr. Anna Mokumbi, co-chair of the Lancet NCDs and Injuries Commission, NCDs and Injuries of the Poorest Commission. We'll hear from Dr. Chris Ben, who is Director for Global Health Diplomacy at the Yablanga Institute. And we'll hear from Radhika Srivastav, who is the Director of Health Promotion at Hriday, the Healthy India Alliance. And then thirdly, we'll move to the third theme on innovative finance, and we'll hear from Ingvar Theo Olsen, who is Policy Director for Health at the Norwegian Development Assistance Agency. We'll hear from Dr. Nick Van Altava, who is head of the Secretariat of the UN Interagency Task Force on NCDs, and then from Dr. Sue Henschel, CEO of the City Cancer Challenge. So a lot of exciting speakers. We could listen to all of them for a long time. So we're insisting that they be brief so that we can have discussion with all of them. So without anything else, we'll start with the theme of health security. And please, Dr. Colin Tokwitonga, please give us your opening remarks.
Good morning, all. Thank you, Rachel. I'm just trying to, can you hear me now?
I can hear you very well. Thank you.
Well, thank you
And
very
see
much.
you.
Firstly, thank you to the Alliance and the partners for the invitation to share some thoughts with you. I have to say, I'm very pleased that the issue of financing, innovative financing and investment of NCDs is being very topical and discussed at the global level. I guess it's widely known that in the Pacific region is often described as the epicenter for NCDs, and we have some of the highest rates of obesity and diabetes in the world. We've also been very fortunate that the political leaders have paid attention to NCDs and have made several declarations on their concern, describing NCDs as a crisis. The unfortunate thing, of course, is that the political will, the political commitment has not translated through to the resources that we need to do the job, so to speak. A bit of background, the Pacific region is hotly contested by several superpowers on the Pacific Rim at the geopolitical level, and health security has become very topical and very important. But at the local level in these small islands, many of them, most of them, spend less than 5% of GDP on health. And as you know, it's very difficult to provide basic levels of healthcare if you're spending that level of the national resources on health. And governments have a very big role in small island states in terms of financing and delivering healthcare. So the prospect that these small island nations will allocate more resources to tackling NCDs, and now, of course, for COVID-19 is rather remote. And unless there's additional support from ODA sources and other partners, the prospect of further investment from within local resources is remote. And as I say, even though there's many of the islands have not reported a case of COVID-19, nonetheless, many of them, most of them, will have allocated some of that scarce resource towards preparation for COVID-19, and many of them have shut their borders. And so the opportunity for economic activity has been reduced, and in some cases ceased completely. And I refer to tourism, which is a big part of the revenue streams for many of the small island states in this part of the world. On the upside, I think given the scarce financial resources, they've been quite creative in terms of the partnerships, often supported by development partners. And I spoke in Sharjah around the Pacific NCD roadmap, which has been used very effectively by small island states in terms of their actions to prevent and control NCDs on the ground. My final comment in this respect is that we've had a rather tough time with regard to global facilities, financing facilities. The Global Fund for TB, malaria, and HIV/AIDS has been rather challenging for many small island states in terms of the requirements to be able to access the funds. And I would say that from the small island developing states perspective, if we were to get into resources through a global facility, we need to be very careful about the demands, the administrative and bureaucratic requirements for small island states to be able to access those facilities. And if there was a preference, it would be to have something more local, something where small island state governments can have more influence more directly in regards to these facilities. And so just to finish off again by saying, that this is a very welcome development, very welcome discussion. The burden of NCDs in small islands, developing states is such that it's a threat to development, to security, to health systems' ability to provide services, and the current allocation from within local resources is such that it's grossly inadequate for what is required. And some additional contribution from outside in whatever way it's efficient and effective would be most welcome. So thank you very much for the opportunity again, Rachel.
Thank you very much, Colin. That's a great introduction, and I think it's very important that we understand the specific and particular concerns of small island developing states. And I know our sponsor, Jamaica, and the countries as well in the Caribbean region have as well raised a lot of these issues and been leaders on this topic. So thank you for those remarks. We're going to move right away to Francesco Colombo, Head of Health Division of OECD, to give us an OECD perspective on the health investment and funding in the context of global health security and COVID. Francesca?
Thank you very much. And let me see if the video starts. Can you see me?
Yes.
Great, fantastic. Very much following up on what has been said, two main points perhaps that I would like to make. The first one is around these issues that you mentioned about security and the combined threats. And I think we need to be very, very clear about the complexities of these combined threats. There are many, many, many different levels, but to mention just 4 of them, there is obviously the immediate impacts on the health of the population from COVID-19 in terms of those that suffer, those that the diseases, particularly socioeconomic groups, which are more vulnerable, elderly people, but especially among those who have underlying conditions and so forth. So there is that direct threat. There is the threat for other people who have different needs, very much linked to things like cardiovascular disease, cancers, and so forth, and who have not been able to access care in a timely and quality way. There's that threat, and we see the consequences down the line, and we're already starting to see some of that consequences. I think there is a threat which is linked to the economic situations, the major impacts on the economy, on the labor markets, the ability to participate in the labor markets, unemployment that we will see, and the consequences that this will have, not just on the mental health of people, but down the line also on NCDs. And I think there is a threat which is linked to the quite unstable geopolitical situations in terms of how can we make sure that there is galvanized continued efforts in a context in which discussions at geopolitical levels are still quite tense. So with that context, my second point which I want to make is about how do we pitch the conversations. And one of the issues that we have been trying to work on at the OECD for many years as well, is that very often in health discussions, the conversations remains around very health issues. So we talk about, of course, the combined issues created by NCDs, inequalities, now COVID. We talk it in terms of death, fundamental issues, don't get me wrong, of course, the consequences for the health systems, but we're not good enough at pitching that to Minister of Finance in terms of returns of investments from investing in health, in terms of impacts on economic growth from having underlying health conditions, in terms of the cost to GDP, linked, for example, to risk factors, and in terms also what could be the growth potential on having more investment in health in the context in which economies are going to be suffering from COVID-19. And so I think we need to change that conversation to speak much more the language of finance ministers, so that we are able to tell them that what has been going on thus far is not really what will make economies growing in more inclusive way and in faster way. And despite all really the talk that we have been making about investing in health, spending on health is overwhelmingly still on curative care. Only 3% of total health expenditure in OECD countries is devoted to prevention. So how can we change the dialogue? How can we talk about the wider social economic benefits from investments in health? And how do we really convince policymakers? Well, probably we need to speak the language much more of Ministry of Finance. And I'll stop it there for the moment, but happy to come in later.
Great, thank you so much, Francesca. And I'm going to kick off with a question for both Francesca and for Colin, and then invite the other panelists to come in. I know they haven't given their remarks yet. We'll come back to that, but we'll have a discussion here for a short bit, and then we'll also come to the questions from the chat box. But let me just kick it off first, I think, with the theme that you brought up there, Francesca, about not making the point strongly enough or well enough to the holders of the purse strings about the importance of investing in health. I think COVID-19 has demonstrated that better than any words that we have been able to come up with, and better than any analyses that we have done. And we all know now that we have a lot of investment cases, country and global investment cases that Katie referred to, that demonstrate the high return on investment, not just from health broadly, but also from investing in NCD prevention and management. The return on investment, country after country, and my group and others have done these analyses quite broadly now, is very positive. Yes, NCD care can be expensive, but it is cost effective, and it returns over many years, it returns more than it costs. So we have evidence, but I think, as you said, Francesca, somehow we're not framing it right, or we're not getting it across. And here's COVID-19 to demonstrate the absolutely central role of health in maintaining an economy and in adding to economic growth. So Francesca and Colin, could I hear maybe your reflections on specific conversations that you might have had with finance ministry personnel or others who make these decisions? What are they missing? What else do they need, or how can we frame our evidence better? Over. Francesca, and then Colin, perhaps.
Yeah, sure. I mean, at OECD, we have something called the Joint Network of Health and Finance Ministers. Not ministers, sorry, so officials. They're at the lower level, the ministers. The very first time that we convened this group, it was quite clear that we're talking about very different languages. And so, as I mentioned, Minister of Finance, we're talking about return on investments, and Minister of Health, we're talking about, just DALIs, QALIs, even in terms of the jargon that it was very difficult for them to talk to. So I guess there is an issue of can we talk similar language, but just getting together these two communities that, by the nature of what they work on, have even different terminologies. So I think that's a very, very first step. The second step, it's obviously to continue to generate that evidence. You mentioned, yes, there is ample evidence out there, but unless you continue on generating that, and particularly in the context of COVID-19, it's going to be difficult to change that conversations. And even in the context of COVID-19, the budget situation the countries will face will be very, very tough. And so there will be lots of requests from different sectors of the economy for having that scarce dollars being invested. And so for health, while everybody recognizes the importance of having strong and resilient health, there will be a lot of competition from other parts of governments that will have also their own reasons for why we should invest more in tourism, why we should invest more in education, and things like that. And so being able to show that the returns of investments are particularly important, not just because strong health systems help to prevent a future crisis, but also because investing in a health system will be a stimulus for higher and faster growth. That would be particularly important from my perspective.
Thank you, Francesca. Colin, please.
I referred to the Pacific NCD roadmap as a primary tool we're using in the small island states for which we've had a lot of support. That actually was a request from the finance ministers, and it was jointly launched by the finance and health ministers of this region back in 2014, and it's become a very useful tool to encourage people to move on and implement some of the WHO interventions that have been proven to be cost effective. The basic problem in this region is the small budgets available to health ministers. I referred to the fact that many islands are hovering around 4% of GDP, quite small amounts of money. And so there isn't a lot of wiggle room for finance ministers from within local budgets, if you like, to allocate more to NCDs. And that's why I referred to some creative, innovative solutions to supplement these small island budgets, because they are already at a stretch. And the COVID, of course, is now the big item that's come in over the top of already tight health budgets in small islands. And that's really the risk. And for the longest time, we've been trying to get development partners to be interested in supporting NCDs, but it's been patchy. We've had some support for something to do with preventing diabetes or whatever that might run for 2 to 3 years and then it stops. But these are dreadfully small amounts, ineffectively applied, and so our ability to make an impact on these on a rather high burden of NCDs, compounded, as I say, with the preparations for COVID-19, has really stretched the health dollar in this part of the world, and somehow some external options would have to be considered, or at least some other way of identifying the resources that are needed to try and address these concerns.
Thank you very much, Colin. We have one question that has come up in the chat, and I'm going to go ahead and ask panelists to respond to it. It is about what some call innovative financing. It's really about tobacco and the role of tobacco. We've talked a lot about tobacco taxation, and there certainly in the Pacific, where Colin's just referred to the need to find other ways to raise funds. In the Pacific, in some countries such as the Philippines, we've seen excellent examples of being able to supplement budgets through health taxes. But let's take this question, and because it looks at the tobacco issue from a different perspective. And it's from Namase from Misuru. I'm sorry if I haven't pronounced it well. And the question is, when it is proved that tobacco aggravates NCDs, how far is it correct for governments or signatories to the UN-sponsored FCTC protocol to invest in tobacco cultivation, subsidies, etc.? And I'm going to ask Ingvar, who will speak next in any case, so we'll tee him up here. I'm going to ask him to speak to that issue, because I know that the Norwegian government is looking at fiscal policies or policies, taxes for health as a key component here. Ingvar, could you come in on this question for us, please?
Sure. Can you hear me?
Yes, indeed.
Yes, thank you so much. I know this is, of course, a very interesting and important question, and maybe let me see. I start my video. You can see me, and it's not so easy to answer straight away. I think, you know, we've had a bit of this discussion in Norway because we have considerable tobacco taxes, and we have alcohol taxes and so on, as you all know, and so we have a quite long experience with this. On the other hand, we also have huge investments in international markets through our pension funds or oil petrol funds, and I haven't been following that closely, but similar discussions have been going on with regards to what are ethical types of investments from the government funds as such, and I don't think there's a sort of an easy way around it, other than that it needs to be sort of something that is being discussed or debated in each country, and it's really a much of what should I call it, a part of the overall discussions that need to be going on in countries. Personally, if you ask me personally, I would really say that there are strong reasons to not invest in these in tobacco cultivation or that type of things, and also not to provide subsidies, obviously. And I think this is also the general thinking in my government. However, I can see also situations where there are, where this is very difficult when you have a major industry in country where with lots of employment and so on. So so sort of balancing how to do that, or doing it in the right order, and put something else in that place. I think that would be important. I don't know whether that's answering it, but I think that's just my personal perspectives. Thank you.
Thank you. Thank you, Ingvar. I think it's really great, important to recognize the challenges that governments face, even in these policies that on the face of it from a health perspective clearly are harmful, but it's much more complex. And I think we need to recognize that. So let me move on to the second theme here, and we'll invite some other speakers to start joining in. That next theme is about the integration across different global health goals, programs, and funds. And how can we do better to break out of silos that we're all very familiar with? And again, COVID-19 and its crash into NCDs and people living with NCDs and the risk factors, it makes it very evident to us that we have to approach global health differently. And let me start with Professor Dr. Anna Makumbi, a fellow commissioner from the Lancet NCDs and Injuries of the Poorest Commission. And Anna, would you give us some initial thoughts, please? Over.
Thank you very much. Good morning, good afternoon, good evening. And thank you, Rachel and Kathy, for inviting me to this panel. I'm struggling to start my video. For inviting me to this panel and to share the work of our commission, since you were two of our commissioners. I will speak also on behalf of my co-chair, Jean Bookman, and we'll share the work of 5 years work with a wonderful and incredibly committed team of commissioners. When we started our commission, the world was living an unprecedented level of wealth, but this all has changed with the advent of COVID. COVID-19 is a new player and one that exposed deep inequalities in our societies, and the world's poorest are the most heavily affected. In our commission, we think that we addressed the issues related to poverty, but COVID, in fact, like Rachel was saying, in fact, is helping our message in terms of advocacy. COVID-19, for multiple reasons, targets preferably and most intensively people underserved. People with non-communicable diseases have greater susceptibility, we all know that, but with the economic lockdowns, for instance, people who live in poor settings are the most affected, and in some cases, they are not able to receive essential care. So, the work of our commission highlighted the need to mobilize NCD investment effectively, which is the theme of our discussion today, and in an equitable manner, and to not let anyone behind. So in our work, we concluded that multisectoral responsibility is needed to address non-communicable diseases of poverty, that broadening of the global NCD agenda was needed so that we could tackle and address diseases that affect mostly younger people, that an increase in development assistance was needed, and that this could be done by reaching out not only for governments national civil societies, research institutions, funding bodies locally or nationally, but also to international funders. And these would need great work of advocacy to place non-communicable diseases of poverty in a level of competing with the actual and current silos of fundings that we have for infectious diseases, for instance. Above all, I think that the report stresses the need to address the social determinants of health, such as improved housing, clean energy, food security, education, and safe transport. Relevant to this discussion, while we accept that there is lack of money, and this may increase with the advent of the pandemic, we also have shown that there is a degree of lack of solidarity, mainly led by misunderstanding of the importance and the burden of non-communicable diseases, and also that tackling non-communicable diseases of poverty is indeed a way of investing in the communities and towards welfare. So our commission aimed at helping us to understand this and to support mobilization of investments for non-communicable diseases, and even more now in the midst of COVID. One of the findings of our commission is that we had more than 150 diseases, and this calls for not only a shift to people-centered care, but also to integration. And in reframing the non-communicable diseases agenda globally, we are calling for integration of care, but also integration of science and care. We are witnessing improvements in disease-specific movements, but we think that our message should be that there is an opportunity to merge efforts. These efforts will allow us to strengthen the health systems, and then will allow us to combat these diseases. And this could also be potentially a way to motivate donors to increase funding for non-communicable diseases of poverty and to non-communicable diseases in general. Finally, by integrating care and science, and by integrating competences in specific cadres in the health systems in poor settings, we may also help to not only advocate towards financing for NCD, but also improve knowledge about neglected non-communicable diseases that can then serve the world globally. So we think that increasing knowledge in non-communicable diseases is also a way to integrate science and care and to build forward better. Thank you, Rachel.
Thank you so much, Anna. I think that this report and your remarks here are such an important reminder that NCDs are much more than the 4x4 or now the 5x5. There are many, many conditions that are very treatable cost effectively and equitably that are described well in the Commission's report. So thank you. I think that the point you made here too at the end about integration is a nice segue over to Chris Ben, who will speak a little bit about the issues of siloing. I think Chris has experience from having spent some years at the Global Fund. And the Global Fund, of course, with attention to sort of classically siloed conditions of HIV and AIDS, TB and malaria, but also looking maybe differently now in the new world that we're in, as well as these other global institutions looking differently at where NCDs fit in. So Chris, if you could give us some initial remarks on that, please.
Sure. Thanks a lot, Rachel. It's great to be able to contribute to this very important debate. And we have already heard a lot about the undeniable and overwhelming importance of NCDs, and Anna just very eloquently made that clear. And I think the Lancet report provided a lot of further evidence that we needed. But we also know that still the funding is very inadequate. And, that has not changed really in spite of all the kind of evidence that we have. So I would like to, make a few points that I hope will move this discussion a bit forward. First, I really welcome the establishment of the multi-partner trust fund. I do think that this has been an important step towards the integration of the NCD issues and the funding opportunities that was required, because it was a kind of missing piece. But even with that, we also see, and we've seen over the last couple of months, how inadequate the current system of financing global health has been. Even if all of us are aware of the kind of enormous economic cost of COVID, just look at the international COVID response, the ACT Accelerator, the investments into vaccines, diagnostics, and therapeutics fall far short of what is required, in spite of every politician around the world knowing, what the cost has been. Leave alone then the additional investments that should be made, for example, into NCDs, as we are talking about a syndemic now, and we realize the connection, or other very important investments that should be made, for example, also into digital transformation that would help many health systems around the world to be more efficient and to kind of help implement them, all these important interventions. So the system that we depended on development aid for a couple of global health interventions has not worked, and is now apparent that it cannot finance what is required at a global scale. So therefore, two suggestions for that. In the Job Lange Institute, we have now been promoting a different concept, what we call a paradigm shift, moving from the old kind of system of development aid more to what we call global public investment. These are global public goods, and I think both NCDs and COVID are exactly these problems that affect basically every country and every community around the world. It's not something that is there in some poorer countries, and therefore we do need a global response to that. And we say we need a paradigm shift away from development aid for poverty reduction, more towards reduction of inequality, and also away from this kind of north-south resource flow to poorer countries, to something that is really universal, where everybody, every country will contribute to these global public goods, every country according to their ability, and every country will benefit according to their need. We've just established an international working group to kind of propose that more concretely, and hope to have that in early next year. And a second suggestion that has come up also, because in the last couple of months, the question of debt relief came up again, and the G20 proposed a kind of debt moratorium, at least for a period of time, for highly indebted countries. That in itself could be helpful, but I think it needs to be much more concrete. In the Global Fund, we once kind of championed a scheme that was called debt to health, meaning you can cancel debt, but then also the ministries of finance in the debtor countries convert that into concrete investments into health programs. That could be something that could be applied here, both to NCDs and to the COVID response, actually, because it is indeed a global public good. But it requires something that has already been mentioned before. It requires a whole of government approach. This is not something between development aid ministries here and ministries of finance, health there. It does require ministries of finance, both in the kind of creditor and debtor countries. And I really applaud what Norway has now been proposed and what we are hearing more about in the next session, because that's, I think, what is required in all countries around the world, that this needs to be a whole of government approach. Only then can we hope to mobilize the finances at the level that we require. But with that, with those kind of paradigm shifts, I'm more optimistic that we will come out of this COVID crisis more stronger, and with a different system of how to finance these global public investments. Thank you.
Thanks very much, Chris. That's great. I have a hard question for Anna and a hard question for you. and then we will see if we have some additional ones that come in. But this one came in through the Q&A chat. And Anna, I'm going to come first to you with it. But Chris, let me give you a heads up about what I'm going to ask you. You mentioned the debt to health swaps and debt relief, which have been very, very important historically to help countries overcome challenges and not lose their momentum towards development. But in this crisis, is it going to be helpful to relieve debt when that really doesn't produce additional immediate cash flow? What can that do? Obviously, it's more of a longer term and not unimportant, but how do we balance the immediate needs in the longer term? But Chris, hang on to your thoughts on that one for a moment. Anna, the question that comes in from Elsa Morandat is, many people don't realize, and let me point out, she's quoting Bill Gates from 2016. Many people don't realize that the first 10% you spend on medical care for vaccines and antibiotics has this unbelievably high return in better health. Later, more incremental advances like chemotherapy are nice, but their health return per dollar spent is much lower. How can we make the case for investing in NCDs stronger when people are putting forth that kind of dichotomy? Anna, some thoughts on that? And I can invite other panelists in a moment who might want to speak to that if you raise your hand. Anna, please.
Thank you very much. It's really a tough question, but if we consider then one of our main objectives was also to raise the attention to the fact that NCDs are not just a disease of the old people, adults at 60s or 50s, and we look at globally non-communicable diseases, mainly those associated with poverty, but in many countries that are undergoing the epidemiological transition, also affects younger adults, and particularly in the third or fourth age of life. You can consider that treating, managing appropriately non-communicable diseases is also an investment, because these people are at the productive ages, and in fact, treating them has a social benefit, has an economic benefit from them being well, that is very important to consider. So I don't disagree that preventing with vaccines is important and it's highly cost effective, but one should consider the several aspects that a non-communicable disease can also take. In countries like African countries like Mozambique, for instance, many times these young adults are the ones that run the families, and any single disease can put the whole family into catastrophic spending and can in fact create or aggravate poverty. So that would be the short answer that I would give.
Thank you, Anna. That's very thoughtful, very helpful. Chris, briefly on the question of short-term versus long-term finance.
Yeah, I would not necessarily agree that, debt cancellation or debt swaps cannot lead to immediate cash flows, because basically the moment that a creditor country cancels debt, the Ministry of Finance on the other side can release that money for their own kind of Ministry of Health. And I know from many negotiations with these countries that the Ministries of Health appreciated that very much, because they said, this is like an internal cash flow, right? And increases our kind of position vis-a-vis our own Ministry of Finance. Colin mentioned that earlier, that, in some countries, the level of kind of support from the Ministries of Finance is fairly low for health. And this is a way how they can convince their Ministries of Finance release that money, because on the other hand, you will get your debt cancelled, usually with a kind of discount that makes it even more attractive. But once the negotiations are done, and that's simply a question of political will, the cash flow can be pretty fast.
Great, Chris, thank you. I think that's an optimistic and helpful, encouraging response. I'm going to come next to our next panelist. We haven't forgotten you, Radhika. Radhika Shrivastava from Hriday in India. And she will give us her opening remarks, and then perhaps a comment too on this question that we had about sort of priorities, what should be done first, or competing priorities. Radhika, if you want to comment on that as part of your opening comments. Over to you.
Sure. Thank you so much, Rachel, and thank you to all the organizers for this opportunity. I was asked to talk a little bit about India's Universal Health Coverage Program, which is known as the Ayushman Bharat Program, which is essentially in English stands for Long Live India. This is a program which was launched in 2018 with much fanfare in the country. It claims to be the largest health assurance scheme in the world, which aims to provide a health cover of about USD 7,000 per family per year for secondary as well as tertiary care hospitalization. It aims to cover about 40% of the India's bottom segment of the population. So the whole concept of reaching the most needy, which would in India's context add up to almost something like 500 million people. Now, this is a scheme which is fully financed by the government. It has approaches which deal with prevention, promotion, and ambulatory care at the primary, secondary, and tertiary levels. It has two components. The first one is where the prevention and promotive health aspects are addressed, which is the establishment of health and wellness centers. In terms of the Indian context, in our healthcare system, pretty much like several other countries, there are primary healthcare centers and sub-centers. So what this program is attempting to do is to reorganize and recalibrate those into comprehensive primary healthcare centers, which would include services like maternal and child healthcare services, as well as NCDs, including free essential drugs and diagnostic services. The second component of the program is which is dealing with the health insurance part of it, or the health assurance part of it, like people in the country like to call it, which is essentially about providing the health protection cover to poor and vulnerable families. Now, essentially, again, this was a program which was launched in September 2018, the insurance program. Now, in terms of, I've already alluded to the cover that it provides, but the essential focus is on providing cashless access to healthcare services for the beneficiary at the point of service, that is the hospital. There is no restriction on the family size, age, or gender, and from the context of NCDs, pre-existing conditions are covered right from day one. Now, this is, like I said in the beginning, one of the flagship programs of the government, not just within the health sector, but overall from a government perspective, this is one of their flagship programs. Now, though it is well intentioned, it is well thought through, but then yes, for a huge country like India with a population of 1.3 billion, only the second most populous next to China, it poses several questions and issues that need to be addressed. First of all, it is not a magic bullet, and it is not a one-size-fits-all sort of a magic bullet, which at times it is perceived to be. Yes, there is definitely political will at the highest level, but what is missing here is a more stronger participatory approach and a people-centered approach. And so that is something which definitely needs to be strengthened. The other challenge is that it is completely hospital focused, right? So outpatient care and management are out of the purview of the program. So again, posing a challenge for NCDs. So there is definitely a need for stronger governance and, like I mentioned, a people-centered approach. The other challenge is the limited capacity within the frontline healthcare workers, as well as the overall health infrastructure, to be able to steer such a mammoth program. Now, I think any conversation today is incomplete without talking about COVID, like we said right at the beginning. Now, how has Ayushman Bharat, or this program, the India's UHC program, played out during the crisis? So they just observed about 2 years of the launch of the program, just about 2 weeks back, actually. And so the government gave out statistics saying that about 32,000 COVID-19 patients have received treatment under the scheme since the advent of COVID. And so India saw its first case of COVID the reported case of COVID sometime in January end of this year. So essentially, from the perspective of NCDs, yes, NCDs are covered, but again, it is not something which is designed to look at NCDs from a dedicated approach. So again, some challenges there. Just another point that I'd like to quickly make is about learnings from other healthcare programs when it comes to NCDs. Now, looking at, say, for example, from another communicable disease that India faces a huge burden of is tuberculosis, right? And so there has been at the level of the government, at the national and the subnational levels, a sort of attempt to integrate the National Tobacco Control Program, which is one of another flagship programs under the overall NCD response in the country, with integrating it with the National Tuberculosis Elimination Program. So what the government is attempting to do is trying to integrate the work on the tobacco target of NCDs with the TB target. So, under the SDGs, there is a target to eliminate tuberculosis by 2030. But what the government of India is attempting to do is, giving it itself 5 years lesser and claiming that by the end of 2025, we would hope to eliminate tuberculosis from India completely. Again, a long way to go in that, but yes, a good example of this integrated approach. Also talking about the HIV/AIDS movement. Now, again, in the context of HIV/AIDS in India, there was definitely, when we look at comparing the scenarios of HIV/AIDS as well as NCDs, one of the critical factors in the HIV/AIDS movement was essentially that there was a recognition at the level of the national government that this needs a very specific response in terms of an infrastructure to address HIV/AIDS as well as financial allocations. So what was done at the national level within the Ministry of Health was the establishment of NACO, which is the National AIDS Control Organization, which had a infrastructure of healthcare professionals, bureaucrats. They had a strong civil society engagement mechanism. And even at the subnational level, from the context of a large country like India, state AIDS control societies were set up. So there was a lot of participatory approach in terms of addressing issues, addressing HIV control. So again, there has been a lot of discussion and debate among multiple stakeholders in the country about NCDs warranting a similar approach. But of course, in the current context, which is an approach which is not to say that a separate silo needs to be created for NCDs, but a more integrated approach. So those are just some of my initial points, and maybe a couple of points that I'd probably like to add towards the end of the discussion.
Radhika, thank you very much. I think you've really put the point on how difficult it can be to actually carry out these great concepts like integration of care, and to talk about tobacco and TB, which are clearly importantly related. And it's great that the government has these goals. I mean, goals are really the first step towards being able to then push people towards making change. So thank you for those examples, as well as the HIV and AIDS Commission. I think that we all learn from India a lot, both the mistakes and the successes that happen in India. So thank you. I want to, I think that Sue might be itching to say something about the question that was posed in the chat, in the Q&A from Elsa. And actually it comes from Bill Gates, right? So Sue, I'm going to ask you to come in on this question of chemotherapy being nice, but not a good return on the health dollar. I'm sure that's not the first time you've had that question. No, give us your thoughts.
It's definitely not the first time I've heard this, Rachel, but disappointing because, if we look at the WHO best buys and we consider the target treatment of 80% essential quality medicines, it's clear that this is a cost-effective use of domestic finances and international finances. And so it's hard to believe that we can silo the conversations in this way. And of course, I will have to make a comment about if we're talking about equitable access to health for all, that includes the many millions of cancer patients around the world who are really suffering during this current crisis. The most recent data shows that over 40% of cancer surgeries have been cancelled or postponed in the last 3 months around the world. Now, that is going to have enormous implications going forward for the outcomes of those individuals and for the productive economies of those countries from a broader sense. But if we look at the individual impact, those patients will actually be looking to chemotherapy, for example, in more ways than they are now because they have missed out on life-saving surgery. So I won't say any more, but I think it's a very narrow view, and I think that there are other ways to consider this issue rather than isolating individual therapies or approaches.
Thank you, Sue. I couldn't let that opportunity pass. I'll come back to you in a bit for your other remarks, but let's turn to theme 3. So theme 1, we heard about the urgency of NCDs in COVID days and those linkages and the urgency of thinking about those issues. And then in theme 2 about integration, how can we do better? What should we be doing differently in order to deliver care with a patient-centered approach and more comprehensively and holistically? So in theme 3, we're turning to the issue I think that everyone is always on the edge of their seats about, which is where's the money going to come from? And this is a long-term conversation, and I think we've already pointed to some of the possibilities with Chris mentioning debt for health, and we've touched on taxation, but I'm going to ask Ingvar Theo Olsen to talk a bit about Norway's strategic whole of government approach, and I think taxation may come up as well. So Theo, let's turn to you, please. We can't hear you yet. You need to unmute. There you go. Thank you, Ingvar. Thank you.
Okay, so thank you so much for this opportunity to talk a little bit about the Norwegian strategy. I will not bore you to death on all the different aspects of that, because I think most of you know that it is sort of focusing on the 5x5s. It's sort of cuts across governments. It is quite strongly focused on a few, what should I say, interventions, so sets of interventions within those 5 diseases and 5 risk factors, etc. But the meaning of a whole of government approach, maybe just to stop by that for a second, it really doesn't mean that it reflects everything going on in Norway, but it builds on what our experience in NCD and NCD financing, especially around issues like pro-health taxes and so on. But it is really for the development work. So just so that everybody who haven't heard about this know that what it is. So, but I'd be interested to talk a little bit about the financing part. And as I said, pro-health taxes is really one of the important aspects of this strategy. And we come to that from two different angles. And one is, of course, the health outcomes and improving those by reducing risk factors. The other one is on increasing revenue for health, obviously, and these are different focuses and have different dynamics built into them. But I've also been following the overall NCD financing discussion with quite great interest, and I think and that's something that we really need to look at more carefully. What is really the added value of development aid in financing and funding of NCDs? It's not necessarily straightforward, and especially, how do we do this in the era of SDGs, where we actually want to achieve sustainability by 2030. That is really what we're hoping to achieve. We all know that that's far-fetched in many areas, including probably this one. But what we do is needs to have that perspective, I think. It needs to sort of look towards 2030 and try to put systems and support into that. And that means supporting governments in their own work to collect revenue, obviously, and here is the health taxes. But it's also about putting this into the larger financing systems, because these health taxes or pro-health taxes are not going to solve everything, and we all know that. But we see it as a window into a dialogue with regards to both the larger NCD agenda, but also to the dialogue with the Ministry of Finance, between the Ministry of Health and Ministry of Finance. And I think that is a major part of this. And of course, linking back a little bit to this thing about health benefit packages and public health functions, and ensuring that UHC is really the overarching focus also when it comes to these different types of policies, fiscal policies and instruments available. So what about the funding then? Because clearly there is a strong need for NCD funding to countries, and also to the global actors in this area. There's no way that we can fill the gap, and I think we of course want to contribute to some of the gap, but clearly I think those days are probably gone where that can be done from, or that we think that can be done from external resources, but we can contribute, obviously. But I think our added value is to enable the different actors that we work through to actually work jointly, to approach country governments jointly, or with their with each of their comparative advantages, and sort of come to focus mainly on the long-term capacities in countries. So and of course, in addition to this, it's also the issue of global common goods. There's research, it's all that type of things that also need to be in place, so that we and I can see that clearly there's a role for us as donors in that area as well. However, there's also the question of how much of this is really going to be paid for through the aid budget, and how much is really a general issue. And that's another discussion that we have. So pro-health taxes is of course a low-hanging fruit, not the only one, but we see it, as I said, as an entry point. We work through the Tax for Development program, which has a broader perspective on taxes, and I think that's important to say. But I also really welcome this interagency working group on health taxes approach, where the different agencies involved, World Bank, WHO, OECD, many of you who are present here today, have created a work plan jointly, which I think is quite an important thing for us to build on. And because with our limited funding, we really need to support each of you, of those agencies to sort of work in this joint direction. Our funding will be, of course, catalytic, relatively small. But I think we will do our share here, and we are on the way. I mean, we don't have much concrete to tell you about exactly where we are now, but we are making progress, and I really welcome other donors to join in. Thank you.
Ingvar, thank you very much. I think it's very good to have a reminder that as well off as Norway is, and as generous as Norway is, it cannot fill the whole gap here. And so being able to catalyze others, I think that might be one of the most important, maybe the most important thing that Norway is able to do, is to answer that question. What is the added value of DAH for NCDs? And you've Norway has satisfied itself that there are good answers to that and can help satisfy others' questions. So I think that's really an incredible role that you've taken on, and I think we all appreciate it. Let me turn next, while we're on the topic of encouraging signs towards being able to really make financing and funding for NCDs happen, to Dr. Nick Banaltva, who is head of the UN Interagency Task Force on NCDs. Nick, tell us about the what we've been hearing, the multi-agency trust fund, and the investment that the task force has made in developing the case for the investment cases and developing the evidence. Over to you, Nick.
Thanks a lot, Rachel. You can hear me clearly?
You bet.
Great, excellent. It's a pleasure to be here today, and thanks particularly to the NCD Alliance for bringing us all together. I mean, clearly mobilizing domestic and international investment for NCDs is critical if countries are going to be able to implement the well-recognized evidence-based, cost-effective, feasible intervention. We've already heard time and time again about that. And WHO is the lead UN agency for health and therefore for NCDs, and also for bringing the UN system together. And so the UN system, through the task force, continually highlights the need for ever greater domestic funding. I'll give you three kind of examples where I'm talking about domestic funding. First of all, through joint programming missions. Secondly, through one of its flagship joint programs, and thirdly, through advocacy and awareness raising. So let me just say a couple of words on each. First of all, when it comes to the joint programming missions, this provides the opportunity for the UN system as a whole, through the UN country team that's on the ground, to engage with ministries of finance and ministries beyond health, including parliamentarians, including heads of state. We've done a large number of these, and we find this a really valuable opportunity for trying to make the case for greater investment in NCDs. I just want to give you a couple of interesting examples. One of which is in one country we went to the Ministry of Finance, and he said, "It's really nice to meet you here," the minister said. "I don't know why you're here, because I don't think this is really an issue for me, but anyway, I'm delighted you're here." And we took him through the issues around why it's an issue for finance, why it's an issue for the economy. And at the end, he said that was really helpful, because I really had little understanding on these particular issues and the role for us. And because of the turnover of politicians all the time, I think we have to continually make and remake this case so that they understand. The second example was also another country that we did a task force mission, where at the end we asked, what they really wanted. And they said that they would like to have greater international investment in NCDs. And the point we made was that it's very difficult to be able to go back to development agencies, much as we would like to, and say, please, will you provide additional ODA for NCDs, when countries themselves aren't yet stepping up to do what is required in terms of things like fiscal initiatives, taxing tobacco, alcohol, in the way that they are being encouraged to do so. So again, making those points is really important. Parliamentarians in OECD countries find it very difficult to go to their populations to make the argument for investing in these if countries themselves are not actually moving forward on this. So the second area is around the flagship program that I just mentioned, which, Rachel, you've been very involved in, the joint program to catalyze action on NCDs. And this is a way of taking forward those discussions around investing in NCDs to the next step, doing these investment cases. I think there was about 26 that have now been done since 2016 in partnership with the Russian Federation, the Gulf Health Council, a number of partners on the call at the moment, including Rachel, your group as well, and they help governments understand the direct and indirect costs of NCDs. And although the costs of the health sector are great, pretty enormous, they are actually dwarfed by those indirect costs of premature deaths, so people dropping out of work, the work environment because they die early, absenteeism and presenteeism, i.e. people who are present at work but less productive. And the numbers generated there are really useful in engaging with ministries of labour, ministries of finance, with heads of state, and giving greater ammunition to those, to ministries of health, as they provide the economic evidence for the cost costs, but also the return on investments. And some of the results are quite impressive, really. You know, in a series of about 14 recent countries, we can see that NCDs are responsible for around 4.2% of GDP loss. That's quite a significant amount. And we see, as I was saying, quite significant returns on investment, as I think, Rachel, you were describing earlier. But the other thing that's important is it's all very well providing the return on investments and the economic analysis. It's really important to understand the context that one's working in. So this work also undertakes an institutional context analysis. And that means that you kind of go in to understand what some of the barriers are and what are some of the open doors. There's no point in pushing on one particular avenue in terms of domestic resource mobilization if actually there is very little political appetite in that space, but there is greater in another area. So it's trying to work out where you can move forward to get this domestic mobilization. And now, of course, with COVID-19, it's really important that we're starting to bring in the COVID-19 axis into this work. And we're trying to do some work to see how you can bring that into this investment case analysis. The third area is the need for domestic funding, which was highlighted in the recent task force publication that 30 UN agencies and members of the task force signed up to or contributed to responding to NCDs during and beyond COVID-19. And this was highlighted at the recent Friends of the Task Force meeting last week that a number of you were at. So again, that describes a roadmap for building back better. It highlights the role and responsibilities for all of us together as development partners working with countries to support these efforts and the need for ever greater financing. Let me just finally turn my attention to official development assistance, because while the Addis Ababa Action Agenda made clear that domestic resources had to be the mainstay of the NCD response, it really highlighted, in the same way that we saw in the 3 high-level meeting political declarations on NCDs, the importance of ODA to catalyze the domestic response. And so we've heard from Christoph and others about innovative funding mechanisms and the multi-partner trust fund, which was called for by ECOSOC, the World Health Assembly, and the Catalytic Fund. And WHO, as you now know, is committed to work with the UN and other partners to establish an NCD and mental health catalytic fund. And this was set out in the WHO Director's report to ECOSOC on the work of the task force this year and reiterated by the Director General at Friends meeting. But it's really important that this fund is designed to be catalytic in nature. It's not meant to be, it can't be a global fund. And if we look at the figures taken from those Saving Lives, Spending Less report that WHO issued, it really does articulate the benefits in terms of lives saved, the economic loss and the investment that will be generated from this, and they're pretty impressive returns. I don't have time to go into each of them at the moment, but I think clearly in the time of COVID-19, it's really important that the fund should look to support countries to address NCDs and mental health, part of their COVID response. And we know that there are needs for this. They've come out in the WHO country support plans, the WHO real-time business intelligence dashboard. So we know that there's the demand out there, there's the need out there, there's the return on investment to move forward on this. So I'll stop there and hand back to you, Rachel.
Thank you, Nick. As fast as Nick talks, he could still say more about these issues, I'm sure. He lives and breathes them, and thank you for the shout out, Nick. So there's a lot there to think about and to discuss. I do want to immediately, though, turn to our last panelist. Sue's already come in with a brief comment, but she has some remarks as well, where she can give us another example of success in working in particular with the public and private sectors, which we haven't heard an awful lot about the City Cancer Challenge has been doing for several years. Over to you, Sue.
Thanks, Rachel, and thanks to the NCD Alliance and all of the co-hosts for allowing me to participate today. I'm going to throw in a different perspective, and that's the role of cities. So we've talked a lot about domestic resource mobilization, but I also want to highlight how cities have a role. What we've seen particularly over the last few months is that cities do have a role in health. They've been at the forefront of responses to COVID in a lot of cases, and they've already proven themselves. So we look at climate change and air quality, and cities have been paving the way for some time. And if you look at what's happening around this week in New York, virtually, there's a lot of discussion about the role of cities in making decisions around public health, but also other interventions. Cities are also the pulse of a country. You can see what's happening based on what's happening in this little ecosystem, and sometimes very big ecosystem. And for cancer care, that's really important, because we can look at actually what's happening across the space in terms of cancer care provision, both from the public and private sector. So for those of you who don't know City Cancer Challenge, we work with cities to support access to quality, equitable cancer care. And part of that is doing a citywide needs assessment, which is data-driven. We most importantly work with cities to look at how partners, and particularly how both local, national and global partners can come together to support gaps in services. And most often, I would say that those solutions might be around convening or bringing people together. They might be a policy solution. But of course, as we've heard a lot about today, that's also about financing. There are many aspects of the work that require additional financing, or more importantly, better allocation of financing. So as we've been thinking about the role of CCAN and cities in the world of health financing and mobilizing capital for solutions, we've been thinking about how we can do this from our approach. Really looking very much at a bottom-up approach, asking the question, what are those things that the cities are looking to finance? What are those gaps in services that they are prioritizing, and how can we bridge the gap between the health community on the ground and the finance community and the investment community? So I'll very briefly talk about one example, which is in Yangon, where we've been looking at what happens in terms of access to radiotherapy. This has been a 2-year journey. And it started very much with the city stakeholders convening around their priority need, which is access to radiotherapy for a catchment area of 25.5 million and 6 machines currently. When 50 to 60% of the population, based on WHO and the Lancet Commission reports, cancer patients need access to radiotherapy, you can see straight away that the capacity falls far short of what is required. So from a financing perspective, that's a major investment for the country and is likely to require a lot more than is capable from pure domestic resource mobilization. And what can we do? We can build this case. It's not necessarily the economic case that I think Rachel and others have talked about, but it's looking at that data-driven supply and demand assessment for the needs that can drive then the development of a full investment case. What we have done in Myanmar is to work with local stakeholders over the last 18 months to produce that data. That data has now been consolidated by the IFC, so International Finance Corporation, a group of the World Bank, has taken on an independent assessment of our data to look at the feasibility of leveraging private investment into the creation of greater capacity for radiotherapy, not just in Yangon, but across Myanmar. It's a very specific example. But really, the reason why I think it's important to understand this example is not the specifics around the radiotherapy case, which are very important in themselves, but much more importantly for us is that it's taught us that we can make success happen when we have good data, when we have awareness of local stakeholders, and when we bring partners to the table. So if I could have 3 things happen in every city that we work in, it would be very clear data-driven cases for investments. What is the supply? What is the demand for those priority needs? That the stakeholders, and I'm including health professionals here because they are the ones that are going to make these investments sustainable ultimately, are informed, they understand the fiscal space, they understand the environment they're working in, and that no one partner can do this alone. We can bring, for example, the idea of what it means in terms of the data-driven argument. We can bring the stakeholders together. We can make the government aware of the options, but we need lots of people to join the dots to end up with leveraging private investment and a full public-private partnership, in this case for radiotherapy. Going forward, if I can just say for 30 seconds, I think the answer for CCAN in particular is to look beyond some of these big investments, which are important, as we've talked about, radiotherapy, but there are many cross-cutting examples. And I think I don't like to use the positive effects of COVID, but certainly one of the opportunities that's emerged is in the digital health space, and including much more digital health solutions in the countries we work in through policy change and enabling environments that have opened up over the last 6 months. This has brought a flood of interest into countries around new technology solutions. IFC in the last 18 months have initiated their Tech Emerge initiative. There's a lot of interest in using technology to bridge the barriers, for example, in interoperability, so that there's data flow between different institutions and the cancer registries. So I think there's lots of opportunities, and I think we should be very hopeful. And I think we should be very much more invested about how we can build a groundswell amongst our local stakeholders to actually help bring this to reality.
Sue, great. Thank you very much. Thanks for the great examples and stories. So we are always, as always, a little tight on time. We've had some really nice and interesting questions. And what I'm going to do is I'm going to just highlight a couple of the points that have come up in the Q&A box. And I'm going to invite the panelists to indicate, to raise their hand, to indicate if they'd like to give a quick, snappy answer to any of those questions. And then we're going to go to a few closing comments, including a surprise closing guest. So stay with us as we wrap up these last 10 minutes. So Michelle Farmer has asked about using community health insurance funds to help support national health budgets and address gaps. So that's a question that I'm putting out there. Florence Bertoletti has asked a question about, again, fiscal policies and being able to, why aren't more ministries of finance using the opportunity of health taxes to raise funds, and how would we best convince them? Jonathan Klein asks about meaningful health systems on the ground, and particularly in the age of COVID with greater food insecurity, essential medicines and other issues being neglected. Let's get very specific about how we can build back better. There are additional questions about the tobacco subsidy issue. I'm going to throw in my own. I'm going to take the chair's prerogative and throw in my own, particularly maybe for Ingvar or for Chris. Global public investments, what should those be? What are the priorities? We, of course, know about research. That's a global public good. But what should those collective action investments be? What do they look like? So I think we wanted to see if we could see everyone here in the last few minutes. I don't know if that's going to happen, but people could chat back to me if they want to answer one of those questions. If we're going to be able to see everyone, just indicate with a wave. I'm not seeing everyone yet. So maybe what I'll do is go to one of those questions and see if somebody would like to answer, for instance, the question that Jonathan Klein raised about again, COVID and the increase in food insecurity. And let me add, the very dramatic decline in resources available to countries as GDP shrink for the first time that we've seen in recent years. So who might like to speak to that? Under these conditions, how do we address NCDs with this intense pressure that COVID has created? And just don't wink. I can't see if you wink, but okay, Nick, come on in.
Yeah, I mean, I mean, it's clearly really difficult, but I do think that what this does say to me is that whatever country you're in, however rich a country you are, this highlights the fact that you've got to focus on what are the most cost-effective and the evidence-based interventions. And so we shouldn't feel frightened about this. We can't do everything. We know that in the middle of a pandemic, inevitably, NCD service, like many other services, will suffer, and that's just the reality of things. But as you start to move beyond that, then one has to kind of look at each individual area and what you can provide. And we know once again that many countries still spend too much time and too much effort building big, giant tertiary hospitals and not enough on primary care. There's not enough focus on universal health coverage. There's not enough integration between different elements, for example, NCDs and TB. We heard some really interesting work from India a short while ago. We undertook a mission recently to Nigeria, which was a joint mission between TB and NCDs, and it was quite clear that those linkages are not being made most effectively. So we have funds, even if they are reduced, it just encourages us to be even more efficient and even more effective. And okay, yes, cancer treatment can be really very expensive. It doesn't always have to be, but getting people onto antihypertensive, getting people treated for diabetes is not so expensive and is good use of funds.
Nick, thank you. I very much like the point. Let us not be afraid to make our points and to push them hard, especially given the connection between COVID and NCDs. Who else wants to come in on any of those questions? We really only have a couple of minutes, but let's try. Francesca, please.
Yeah, just to add the point about where do you start in a way, and I think there is something which we have not discussed yet, and it might be more of an issue for the countries which have more resources in, but I think it's relevant for countries at all levels of economic development, that besides not investing enough in health system, we also have a lot of spending that delivers not the best value or the best outcomes for patients. And so this issue of where to prioritize, of course, we're talking about the importance of preventions and primary health care and so forth. But we have done a study about a couple of years ago. They showed that some 20% of health spending does not deliver any improved outcomes, and in some cases could be even wasteful or even harmful. So I think, you know, being very honest about going granularly into where do we spend the resources, and being, you know, able to say in some cases, this is not a good investment, that would probably reinforce the case, particularly in circumstances in which budgets are going to be incredibly tight. I think there were some issues about the fiscal policies. One important issue, which probably is for countries which are middle income or low income, it's also the importance of fiscal reforms, of course, because while you could have some resources generated from fiscal policies for tax reasons, for health reasons, it's quite clear that you need to have a very large fiscal basis to generate those resources which are essential to really properly fund the health system. So I think it's a quite important issue also not to forget.
Thank you, Francesca. Krista, do you want to say a quick word on any of those points? You waved earlier. You're on mute now, but.
Well, you asked me a direct question, so I will very briefly address that. You know, you asked me about debt, how quickly that could be deployed. I said that can be if the political will is there. But to your question on global public investment, that is clearly not a kind of short-term answer. That is a new concept that will require quite a bit of negotiations. But I think it is urgent so that also the world will be better prepared, you know, how to finance these common, you know, goods, you know, that we see now. COVID is completely underfunded, and we do need a concept, and we only have WHO as the, you know, organization with the credibility and authority to kind of put together such a package that will kind of tell the world this is a common good to make primary care systems around the world more resilient to future pandemics and to the onslaught of climate change. And that includes issues like NCDs. We have, you know, you said I've been working in a silo, that is true, but we're trying to get out of all these silos, and we're trying to put this together in a convincing way, and then to finance that in a way different from the old-fashioned development aid approach. So that's not a short-term solution, but I hope it will be a longer-term solution.
That whets our appetite. Thank you very much, Chris. I'm going to close the discussion with the panelists now. I hope that they leave you on. It's great to see you all. And I'm going to move next to one of our hosts. We're really delighted to welcome His Excellency, Mr. Courtney Rattray, Jamaica's permanent representative to the United Nations. And he has agreed to make a few remarks from the perspective of Jamaica, and who has been so long a leader in this area. So thank you. Your Excellency, please.
Hi, Rachel. Can you see me okay?
I sure can, and I can hear you too.
Okay, this is my test of my apparatus here. Let me just say hello to everybody in the room virtually. Good to see Rachel Kite there as well. I mean, Rachel Kite, Katie Dane from NCD Alliance. I'm not sure if she's talking to us from London, but good to see Katie. I was asked to just come in at the end to just contextualize the discussion in the framework of what we're doing as an initiative of Jamaica, Canada, and the Secretary General. I think some, if not all of you, will know about this initiative, which has been dubbed FFD, Financing for Development in the Era of COVID-19 and Beyond. I mean, we kicked off this initiative on the 28th of May with a meeting of 50 heads of state and heads of government, out of which we had a mandate to develop some concrete policy solutions to address the COVID-19 pandemic. We established 6 discussion groups that looked at various aspects of the crisis. And then we followed up with the first ever, actually, finance ministers meeting under the rubric of the United Nations, which was held on the 8th of this month. And then the capstone to that process was a meeting, a second meeting that we had yesterday of all the participating heads of state and heads of government. I mean, we had, I think by my count, it was 55 heads of state and government at the meeting yesterday. And very many international institutions, the international financial institutions, the IMF, Managing Director Kristalina Georgieva, President of the World Bank, David Malpass, the Secretary General of the OECD, Angel Gurria, and many others from the United Nations system and beyond. The issue that we're speaking about today, I mean, I'm trying to wrap my head around it. You have such good speakers that are very technically savvy with respect to these areas, and I'm very much of a lay person when it comes to some of what you're discussing, but I can tell you that this issue of how do you mobilize the resources that are required to address, prevent, and control actually the incidence of and spread of NCDs is something, I think it has bedeviled a lot of us in terms of where is the money going to come from with constrained budgets. I mean, you heard Colin speak about it from a SIDS point of view of the limited fiscal space that we have and all the other priorities that we have to address, many of them having to do with the recovery and response to COVID. So let me just look at it a little bit in terms of the conversation that I just listened to and contextualize it a bit in terms of what we're trying to do with this initiative. So as I said, this cut across the work of many of the working groups, but there's one particular working group that is very relevant, which looked at external resources, external financial flows. And I think the numbers are stark, if not frightening, in terms of the impact that COVID-19 is having on external financial flows, including official development assistance. I think, as you know, that many of the donor countries, many of the OECD DAC members have their own budget pressures as a result of the COVID crisis. And the projections are that the decline in ODA from these countries this year could be on the order of, well, let me just say the OECD's estimates are that if DAC members were to keep the same ODA to GNI ratios as they did last year in 2019, total ODA this year could decline by $11 billion to a level of only $14 billion. And I want you to consider the fact that there are several compounding problems when you look at the flows of external finance into developing countries. Overall external financial flows are projected to fall by $700 billion in 2020 in developing countries. Global GDP, as we heard from Mr. Gurria yesterday, is anticipated to fall by 4.5% this year. FDI is expected to fall by 45% in developing countries. We project a precipitous fall in trade and in tourism revenues, especially tourism-dependent countries like Jamaica and the rest of us in the Caribbean. We will be significantly impacted. Remittances are projected to fall by 20% in 2020. Commodity prices have already fallen dramatically. Angel Gurria said something that I noted yesterday. He said that ODA is only $154 billion, but developed countries have already thrown $10 trillion at propping up their economies in the wake of COVID-19. And he ended that statement by saying, we need to be more generous. He was speaking to the developed countries. There is money out there. Countries like mine that have traditionally been very highly leveraged in terms of our debt to GDP ratio. I mean, when I started at the UN, it was 146% debt to GDP ratio for Jamaica, and we have gone through an extreme fiscal consolidation process, and we have now gotten it down to 90. I mean, to go from 146% to 90% debt to GDP ratio. I mean, you know what that means. I mean, the government euphemistically calls it belt tightening measures. But I mean, every time we draw our belt as a government, it's the poor person that bawls out, ouch, because they're the ones that are most severely impacted by the lack of spending in terms of meeting the public investment needs of Jamaica. And I'm just using my own country. And when I say public investment needs, a lot of people hear public investment and think about physical investment, physical assets like infrastructure, which I think is very, very important. But equally important is the investment that is required in health systems. And so when you have a debt challenge or debt vulnerability like that, you just have huge underinvestment in areas that are looked at as the purview of the government. It is governments that are supposed to be making these sorts of investments. And one of your panelists mentioned the Addis Ababa Action Accord that said that countries are primarily responsible for finding the sums through domestic resource mobilization to implement the SDGs. And that is right, but given the debt dynamics of many countries, it is not going to be possible for them to do it by themselves. And I've just laid out to you the very stark picture that we as developing countries are looking at right now, with almost every single source of external finance drying up. So, you know, we have to try and find a way, as some people have said, of making the investment case to potential investors. And when I say investors, what we're trying to do, I mean, ODA is so low, middle-income countries like mine have graduated, so we don't benefit from the levels of concessional financing that we normally benefit from. Even remittances, even though it plays a role, that is something that is very, very difficult because it goes directly to families. It's difficult to translate remittance flows into government coffers for development purposes. So we really do need to find out how we can work closer and better with the private sector. I mean, that is where most of the capital resides. And a lot of them now are looking at SDG type investments and ESG type investments. And so I think it is legitimate to look at that, but how do you make the investment case? I know you can make an investment case to governments and international organizations that are the stewards of international public finance. And I think that's where the money has to come from. But there's another big pool of money that resides there in pension funds and sovereign wealth funds and insurance company funds. All of these funds are looking to invest their monies because of QE policies. Interest rates are on the floor now, so they're not getting much of a return anyway. And is there a way for us to look at that? And I think it's a very, very difficult, it's a very difficult proposition, because I think the economic case can be made. There is a manifest economic return in terms of investing in NCDs, but is there a manifest investment return when you look at a private investor and the lens that they look at it through, which is, what is the risk return for me putting my money there? How do I get back money? I mean, how do I monetize that investment in terms of a return? So I think that is a very difficult case to make. It may be a better case to make, to look at international organizations. I like what it was either Colin or Christoph, maybe Christoph said about looking at innovative financing mechanisms like swaps. And you yourself mentioned it, Rachel, with respect to debt for health or / debt for NCD swaps. And I think that is something that we have utilized in other areas. I think the process in which I'm involved is calling for debt for climate swaps, debt for climate adaptation swaps. I know ECLAC has a very interesting proposal, but that is a model. It is a model that can be applied to NCDs. I think the taxation thing is interesting, but I don't think it is a silver bullet. And I think we have to be very careful with respect to sin taxes, you know, alcohol, tobacco, whatever you want to say. I mean, in this case, we're talking about tobacco. I have a question about how sustainable it is, because, I mean, you know what the saying is, Rachel, you don't want to kill the goose that laid the golden egg. And so you increase taxes on companies, and you're going to hear the company executives tell you that this is decreasing my profitability. This is going to cause job losses. And if you tax us any further, you're ultimately going to drive us out of business. And then what are you going to have to tax? You're not going to have anything to tax after that. So I think you need to be alert to those sorts of industry pressures that is going to be coming at governments. And obviously, governments need to be financed. They're all belonging members of particular political parties. They go to the industry groups to raise funding. And so when these people talk to government, I mean, government listens to them. And the other problem with that I see is the problem that I can tell you this is as a fact in Jamaica. The more that we tax cigarettes in Jamaica, the more that we drive the illicit tobacco market in Jamaica. And that is something that I think we also need to consider. What are the unintended consequences of that sort of policy, of that sort of taxation policy? I heard Francesca say something that was I completely agree with her, that investing in health systems is a stimulus to faster growth. But as I said, we need to be able to make the investment case from a return on investment perspective in a very, very cogent way. I think the DSSI is very helpful, but I think it needs to go more. The debt service suspension initiative of the G20, which is being supported by the IMF and the World Bank, I think it needs to be extended beyond this year to the end of next year. I also think that it needs to be expanded, not just to low-income countries and to World Bank IDA countries. I think it needs to be expanded to middle-income countries, many of us of which are very vulnerable and highly indebted. Many of our debt actually is no longer being held. Well, let me just say, not that it's no longer, but a lower proportion of the debt of middle-income countries, those of us that have access to the international capital markets, a lower proportion of our debt is coming from official creditors, and a greater proportion is coming from private creditors. And so I do think that the DSSI needs to be extended so that we can get private sector participation. Right now, the private sector is being invited to participate on a voluntary basis, but you know, commercial credit extended to developing countries, certainly to middle-income countries, has increased dramatically. Between 2010 and 2019, it increased from 41% to 69%. So most of the people that are holding our sovereign paper are, you know, sitting on the sidelines with respect to this sort of debt relief. There was a question that was posed, and I agree with Christoph here again, whether or not the debt relief actually provides cash flow relief to countries. And I agree with him, absolutely it does, because we're talking about debt service commitments. You know, the first charge on our budget is the interest that the government has to pay on the money that it owes to its creditors. And so if you provide debt relief, it is an immediate impact that frees up cash, frees up fiscal space, so that we can make the spending that we need to make with respect to public health, public education, road construction, whatever, moving to digitalization or whatever it is. So there are some interesting proposals that have emerged from this entire process. Improving tax administration, taxing the digital economy, illicit financial flows, I think, is a huge area that is being done by Barbados and Nigeria. They're the stewards of that process. And so I think curbing illicit financial flows is one way to encourage greater domestic resource mobilization. Let me just stop here, but I mean, very interesting discussion. I think we could continue it for another couple of hours, but just thank you for giving me the opportunity to share my own thoughts in the context of the initiative in which Jamaica is involved with Canada and the Secretary General of the United Nations. Thank you so much.
Thank you very much, Courtney. Thank you to Jamaica for partnering with Canada and others on this initiative. It's so important, and for your thoughtful but sobering comments about the macroeconomic condition in which countries are finding themselves. That is very much a part of the background, very much a part of the scene for who knows how long. That's another part of the problem. It's very difficult to make projections in times like this and to plan. So I think it's very important that you've brought those points in. I want to thank participants for staying with us just a few more minutes. I know we're a bit over, but this is such an important and thoughtful conversation. I'm going to, and it's nice to be able to see the panelists. I'm going to turn to Katie for just a few last comments. I think that we know there's much more to be said, and I know the NCD Alliance will keep this discussion going. I think we have a good bit of momentum, including some discussion about having a second global conference on financing for NCDs as well, and thanks to Denmark and the WHO for sponsoring the first one in early 2018. It may be time for another such global discussion, but in light of COVID, it would be a quite different discussion than what we had in early 2018. But Katie, over to you, please, for your last thoughts.
Thanks, Rachel, and thanks to Ambassador Rattray for joining us and for really placing our conversation within the context of the financing for development deliberations, and obviously also the real stark picture for many developing countries and the challenges that they are facing. And also thank you to our excellent panelists for today. We've covered a lot of different ground, a lot of different areas of financing, and for Rachel's expert moderation in pulling it all together. I think it's from my side, I think it's clear that, you know, we've all been for many years making the case for investment in NCDs. But I think, as we've heard so far, COVID has been a brutal kind of reality check that we haven't done enough. But on the flip side, as Rachel was pointing out earlier, you know, COVID illustrates the case for investment in health, in NCDs, in resilient populations, far better than any other analysis or research paper could do. So we've heard many examples of how we need to be doing things differently to build back better and build forward after COVID. And just to highlight a few of these, you know, in the longer term, it was highlighted by Christoph that COVID can be a catalyst for reforming the global system and architecture for financing, for which NCDs is one important part, referring to kind of a paradigm shift to global public investment and a shift away from the north-south dichotomy to truly kind of international cooperation. We've talked a lot about the national level, and I think Colin really highlighted the challenges and the limitations around fiscal space for many low and middle income countries and small island developing states specifically. And the reality that there's very little wriggle room when you're talking about spending less than 5% of GDP in these contexts. But I think an important point was made around the fact that this is not just talking about more money and more financing, it's also a matter of improving efficiencies in current spending and budgets that are already there. I think another important point that's been raised and is very much a kind of foundation of our whole NCD response is this point around whole of government. You know, how many times do we speak about whole of government and whole of society in NCD discussions? It's kind of front and center of what we do. But I think it's even more acutely an issue when we're talking about financing. And I think Francesca made the point very clearly that we haven't been making the case well enough to ministries of finance and ministers of finance who hold the purse strings. And, you know, we're talking different languages when we're talking about health or finance, and that we know that ministers of finance don't want to be given more problems. They've got an awful lot of problems on their shoulders. They want to see solutions. They want to see data that is relevant to their country. And they want to see both long and short-term investment data and returns on investment, particularly within their 3 to 5 year political cycles. So we need to be within that kind of, you know, short-term as well as long-term arguments to be made. And also the point that pro-health taxes are a way of kind of starting those conversations with ministries of finance, that they're a kind of low-hanging fruit, but also the process of starting that conversation opens up doors to these broader discussions around the NCD agenda and other areas of investment that needs to be made. And different panelists have highlighted various different strategies of unlocking potential financing. We heard from Radhika about the example of UHC in India and the fact that there are these opportunities of integration into global health and health priorities within countries, but conceptually it perhaps is very clear, but the reality on the ground is very different and difficult to really be unlocking. We heard about debt to health swaps. We've talked about the added value of development assistance for health for NCDs as a way of catalyzing the response and building capacity within governments, as well as the critical role that cities can play in, again, not just about raising more money, but also in spending it and allocating it in a better and more strategic way. So we've covered a huge amount of ground, and I think also there's been a good focus on solutions and a level of optimism of how we can build off where we are in terms of the COVID context. And I want to really end by just encouraging us to continue these discussions, particularly as Rachel just said, at the beginning of conversations of a potential second global dialogue on financing for NCDs, which will be an important convening of the community to be shifting from the kind of political rhetoric to much more about action and investment in NCDs. So thank you again, and back to you, Rachel.
I'm just going to thank everyone that stayed on for our cocktail hour here and our virtual cocktail hour. It's been a great discussion. I won't add to those excellent summary points that Katie made, except just to thank everyone. It's wonderful to see you, wonderful to have this discussion with you. Take good care. Good evening, good morning, good afternoon. We'll see you next time. Bye-bye.
Thanks, Rachel.